So many organizations have focused on their top line revenue as an indicator of their success for many years, especially in thriving economies where revenue and cash is flush. Being able to dive into the more intricate financial information sometimes felt less needed than at other times when you have different economic stressors in place. So, where top line revenue is a great indicator of where you're pushing, it doesn't really tell the true story that an organization has. From my perspective, top line revenue is great, but what about gross profit? What about net income? But what more importantly about those indicators, those key performance indicators that drive those actual numbers? So when we look at how organizations can deploy technology into their finance and finance operations, we look at what technology can really drive more in-depth financial reporting through statistical information that overlays into the financial information to provide them data sets that tell them whether certain practice areas, certain services that they're offering actually drive profitability to the organization, or at the very least, drive secondary revenue to the organization. What I mean by secondary revenue is like if you have a patient come in for one thing, can they then turn into a reoccurring client of something else to be able to provide them services that support their health and their needs? So when I look at the kind of KPIs that start diving into this kind of thing, it's like patient outcomes tied to cost. It's provider utilization and productivity, costs per patient, revenue per patient, days in AR, meaning how liquid is the cash within our business. Staff turnover is another huge indicator of whether an organization is going to be profitable. The more staff turnover you have, especially in healthcare, the more training, the more adoption into the organization there is. So when we start looking at evaluating organizations and helping them turn revenue into profit, and that's a very key component to what we look at from a finance operations is revenue to profit. We want to be able to go deep into all of that financial data to make good decisions. And in today's economy, healthcare is one of the industries getting pushed the hardest from an increased cost perspective and a decreased coverage from a population perspective. So these data points mean more than they've ever meant before.